Normal blood pressure is 130 by 80. When you call it hypertension, the definition of hypertension is when the systolic blood pressure is more than 140 and diastolic is more than 90. 140 by 90 is called hypertension. Who is at risk? The person who has, so there are so many factors, including the age, sex, genetic predisposition, lifestyle, diet, alcohol, mental stress, family history, and those who take alcohol, the smoker, those who are working with a high profile job, that are under stress. And nowadays we are seeing in the young people also, because nowadays there is no physical stress, more of the mental stress. These are the people who are high risk for developing the hypertension. Symptom, we see people coming to us for some other disease and then we detect the hypertension. The majority of patients with hypertension, they are asymptomatic. There is no symptom. So when you get a symptom, they are usually because of the complication of the hypertension. Like you, sometimes you can have a headache, giddiness, but when they come to us with hypertension, that is a severe stage, they can have stroke, they can have hyperinfarction, they can have brain hemorrhage or some disease. That time they are symptomatic. Usually the blood pressure simple symptoms are headache, irritability, insomnia, but you need not have all these things in all the patients. Usually we can call it the in initial stage we have asymptomatic people coming to us for some other reason or they are going for a medical checkup. That time they come to know that they have blood pressure. So there is no initial stage, there is no symptoms. Hypertension, as I told you, it can affect the any system of the body from brain to heart to kidney, anywhere the blood pressure affects. If you are not controlled, you will end up in a complication. The complication can vary from the minor complication to severe complication. The severe is like heart attack, myocardial infarction, you can have brain hemorrhage, stroke, you can land up in a chronic kidney disease, kidney failure, or acute heart failure. Sometimes it can be life threatening also. So these are the complications you can face if you are uncontrolled severe hypertension. The hypertension is very high. BP is more than the grade 3, stage 3 hypertension. They usually land up in a hypertensive emergencies and then there is a complication. High BP patient is careful about is most important thing. Take the regular treatment. Do not stop the medicine unless your physician tells you. If you are taking a regular medicine, you are taking regular keeping your blood pressure under control. The complications are very rare. The complications you will develop over the time. If it is a long-standing hypertension, you are bound to get some complication. But if you do not take the medicine, you leave the blood pressure untreated, then you will end up in a complication. The complications can be anywhere. It can be cardiac complications, like you can have a heart failure, you can have a myocardial infarction, you can have multiple chronic heart failure diseases, peripheral vascular diseases. These are about the cardiac complications. Then our neurological complication like stroke, which can be intracellular bleed, you can have that is brain hemorrhage, you can have a stroke, paralysis, you can have a kidney problem that a person who has untreated long-standing hypertension can go in chronic kidney failure. Later on, they land up on a dialysis. Then you can have a complication in eyes. The common disease you find in eyes now, progressive retinopathy or hypertensive retinopathy affecting the eyes. So which are very much preventable. So these are the complications you can land up if you are not controlling hypertension. Very common. So if they are not taking a treatment, they will 100% land up with some complication. So if you take the medicines, the complication can be delayed, can be prevented. See, hypertension, as first thing is if you have mild hypertension, there is strong role of lifestyle modification. Lifestyle modification is you reduce your weight. If you are overweight, reduce your 10% of the body weight. Reduce your salt intake. Salt should not be more than 2.5 gram per day. Reduce your alcohol intake. In a male, it is 60 ml per day. Female, it is 30 ml. Or you can go for alcohol abstinence. Stop smoking. Then increase dietary intake of fiber. Increase the fruit and juice which contain high magnesium, high potassium. Avoid oily things. Check your weight regularly. Go for a 30 to 60-minute walk. Go for a yoga, and then there's this amount of stress management and have proper sleep. These are the things which help you in preventing the hypertension and even controlling the hypertension. But that is in the mild cases. Once you get a blood pressure after we call it dash. After the dash, the treatment person is not responding and still the blood pressure is high, then you start with the treatment. There are the medicines, there are multiple medicines, the different type of medicine there for age, for associated disease, which can control your blood pressure, it can keep your blood pressure normal. The most important thing you have to keep the medicine regular. You cannot stop it and suddenly start it. So that is the risk when your sudden blood pressure increase. Can hypertension can be prevented, but if you have family members, you will get it. But if you there are some things like where you can keep yourself away from hypertension is the stress management, weight control. Avoid these things, whatever I mentioned you, alcohol, smoking, and regularly do the blood pressure check. Keep your life regularized, have enough sleep, proper rest, yoga. That much things can make, if you have family history of hypertension, yeah, one day you'll get it. But you may get it after 55, 60. But if you're overweight, you can get hypertension at early age. So obesity and insulin resistance and hypertension, they goes hand in hand. So you can prevent the hypertension by keeping yourself healthy, by taking care of yourself. But if you get hypertension, then you start it.